Everybody, and good afternoon to everybody. Today we are joined by Pereira-Sanchez. He is a clinical instructor in the Department of Child and Adolescent Psychiatry, and he is currently working in New York University, Langone Health, and his work is supervised by Dr. Francesco X. Castellanos. And I believe he's working on, he's doing some research on the use of fMRIs on ADHD and other disorders in children. Use of pharmacotherapy, and I believe he's from we are joined by Dr. Gupta, who is the president of the Indian Dr. Shah, and we're also joined by a psychologist from Raja Science College, students from CLMC Calcutta, and I believe some medical students have also joined us from SAMSA, which is South Asian Medical Students Association. So I welcome Victor to CLMC. Today, Victor will be giving an introduction to medical psychology. Now, this is the students, both men and female. Sunny, I think you should mute every other screen. Sunny, if you can hear me, I think you should mute everyone other than myself and Dr. Sanchez. And Dr. Kha is there, who I think the Indian Psychiatric Society would also be interested in organizing programs with foreign faculty and also explore ways in which we can collaborate. Victor, to start lecture. Thank you.
Yes, can you all, you can put in the chat, can you all hear my voice clear?
Yes, yes.
My voice is clear. And it's not, okay. Okay. You muted me. Okay. Now I'm not muted. Okay. I hope you can hear me well, and you remain muted through my lecture. Everybody can hear well, and please, for the organizers, make sure that all the new people that join the meeting are muted upon entrance, because by default they are not muted. So
Dr. Sanchez Pereira, New York.
Can you mute yourself, please? Can you mute everyone? Okay, thank you very much. Okay, namaste, good evening there in India, good night, good morning from New York. It's 10 a.m. here, and it's a very nice day of spring. And first of all, it's an honor for me to join here, and to join the other panelists, and to join the president of the Indian Psychiatric Association, and to teach to you. And I am also so grateful for all of you to make the time to be here, to learn in the midst of a very difficult time. I know it's you are having in India with the COVID pandemic. So my best wishes and my prayers are with all of you. This first module I have the honor to give to you. It's about an introduction to medical psychology. So as I understand from the organizers, most of you are either medical students or pre-medical students, or will work in healthcare. And I will show you with a little bit of theory and with some cases from my clinical experience how understanding psychology is key to be a good healthcare professional, to be a good doctor, no matter if you will be a surgeon or a gynecologist or a psychiatrist or a nurse or a physiotherapist. We need to understand that human beings have a psyche, and that psyche is determining their behaviors, their cognitions, and their emotions. And you can, I have shared the materials in PDF with the organizers, so they can send it to you and you'll have access. My slides are not very busy. I have more images because I don't want you to copy the text or to be so much attentive to the text. There's very little text. I want you to look at the slides and to hear me with attention. And if you have any questions, you can reach out to me by email, or well, I have these social media handles. But if you have any question about a specific question, I'm good at following back and some from time to time going to the social media, but I'm not very good at having direct messages. So if you want something important from me, just email me. Okay, and these nice paintings are from Salvador Dali, who is a painter, was a painter in the early 20th century, was from Spain. As myself, I'm originally from the north west of Spain. He was from the northeast, and he was said to have bipolar disorder, and he was probably part of his creativity was because he had a bipolar disorder, and he was the leader of the surrealism movement of the 20th century arts that conveyed and convey the surrealism and convey the notion of the unconscious that was brought by Freud and psychoanalysis, as we will present. At any point, you can put questions on the chat. I will not be very attentive to the chat during the lecture, but I will look at the end, and the organizers can also be tracking the chat and let me know. Okay. So I have no conflicts of interest, and yes, I'm working now at NYU, New York University, and also started to work for Columbia University. Okay, so the outline. So we will start, we will finish with two cases from my training as a general psychiatrist in Spain. And these two cases, you will see from these two cases, one I saw it as he came to the psychiatry department, to the outpatient department, and the other I saw it was in another medical department, and I saw it as a consultant psychiatrist. So they illustrate that no matter where are you working in medicine, you will find cases and you'll find patients where you need to understand well the psychology. Okay, but we will go through some concepts key to understand medical psychology and to understand how psychology can be used to help patients, to diagnose patients, but also to help patients through their medical conditions. So first, case presentations. The first case presentation, so, well, this is a picture from Google, but let's call her Mrs. Francisca. So Mrs. Francisca was a 60-year-old lady. So for 30 years, she had been with a chronic cough, and this cough was persistent. She would have cough all day, was very limiting, and there was nothing she could do to get rid of this cough. And so she started going to doctors. She first went to the primary care physician, because in Spain and there's a centralized public healthcare system, so people will go first to the primary care physicians, and the primary care physician will try to help with some medications, but she continued with the cough. So the primary care physician referred this lady to an ENT, so nose, throat, and ears physician. So they conduct tests with her. So they determined that the origin of the cough was drops from the sinuses that were falling into the trachea. So they did a surgery to clear the nasal sinuses, and this lady stopped coughing after the surgery, stopped coughing, and would not cough for a couple of years. But after that, she started again with the coughing. And they checked that their nasal sinuses were clear, and that she was not having back nasal drops into the trachea. So they refer her to the gastroenterologists. So the gastroenterologists, they also conduct tests to her, and they determined that the origin of the cough was because of herniation and of the hiatus. So they determined that this lady was having reflux.
Hello.
Okay. Can you mute? And the origin of the cough was this reflux. So they conducted 3 surgeries in the span of 10 years, 3 surgeries on the esophagus. And after each surgery, she could improve and the cough would disappear. But after 3 years after each surgery, the cough will come back and would be the same. So finally, they didn't know what to do with this lady. And this lady was sent to a cardiologist and see what else could be done. So the cardiologist, they did their examinations, they did electrophysiology tests. So they thought that the cough was caused by an arrhythmia an arrhythmic circuit that was in the vagus nerve. So they did an ablation of that arrhythmia, and this lady stopped coughing, but only for a year. And after that, continued, and they didn't know what to do. So they called me. They called me and my team, psychiatrists, and we will see what happened. And we will see what happened. And at the end, I will come back to this case. And after what we learn, we are going to decide what concepts of medical psychology that I will be teaching are relevant to this case. And the second case is Mr. Tomily. So Mr. Tomily he came to the outpatient department of psychiatry. So he's a 34-year-old man. So he was very, very physically very active. He was working in a factory. He was very good at his job, and very intense social life. Um, he, had a, he had a partner, and he had a sexual life, and yeah, and he was enjoying life. But um, during COVID, he lost his job, um, and he started. Well, they were confined in the house, so he started having some problems and some conjugal problems with his partner. He started to become very apathic, very 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 passive, uh, very inactive. Uh, and, and he would, and he would eventually, because of the crisis, the financial crisis, lost his job. Uh, and after losing his job, he 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 started becoming very sad. He would all day he would spend all day at home. He would he would not get up from bed and want to physical exercise anymore. He was not meeting friends, not even via Zoom. Um, and and he was and he started to feel physically very fatigued and start having some problems in the and some symptoms of kind of schizophrenia and diarrhea, and they test him for COVID, and he's so. Please mute everybody because we are having. Sorry for interrupting. But, I can increase my audio, but you have to mute. Everybody has to mute. Please, because not you're not trying to listen to me. So please, the organizers, mute everyone. Myself. So we will also see what happened. What happened to to this guy, to Tommy. Okay. So to understand psychology, is very important to understand first what is man, what is woman, because depending on the answer you give to that, your understanding of the psyche of the person gonna be different. Your understanding on how mental health works gonna be different, and your understanding on how to treat disorders is gonna be different. And there are different conceptualizations. So um, there are people and cultures that have understood man and woman as creatures of God and endowed with soul and with body. The body has a brain, and the mind will be an interaction, a point of encounter of the brain. The body. There are also but this informs particular psychology. There's also the old Greeks would talk about the man as men and women as rational animals. So they would understand them as animals that have this faculty of reasoning, and that also influence how do you understand psychology? Also, yeah, there was also in France during the Enlightenment. You will have these French philosophers, well, that were preceded by Descartes, and Descartes had a Platonic vision, so he was very much influenced by the Greek Plato, and he would understand that the mind and the body were different, completely different parts of the of men and women, and that and that body and mind would only partially interact. So that would create something that in psychology and in psychiatry is called the dualism. So understanding the mind as something totally different from the body. So, and understanding mental disorders as something totally different from medical disorders. Also, contemporary cultures and ideologies. So, for instance, Marxism and communism, and they understand men and women as they don't believe in the soul. They are materialistic. So they understand that the men and women are just are elements for production of work and labor in the state. So their psychology is going to be different. It's going to be very materialistic. There are some philosophies that and some psychological currents that would emphasize that men and women, they are dominated by passions and by instincts, being the strongest instincts, the sex and the rage, the envy. So there's one philosopher, one French philosopher, that would say that the man is a wolf for other men. So he would have this pessimistic vision that human beings are selfish and are dominated by passions. And then we have now this transhumanism. So we have the interactions. We have these interactions between technology and humanity. We are having this issue of the cyborgs on what is to be a man. Can computers be human beings at some point? What can you understand? So is there a psychology for computers? And that's very interesting. Okay, after saying so, let's discuss the biopsychosocial model of medicine. So in 1977, this Dr. George Engel, he proposed a model that, well, this is a model that many doctors were already practicing, but this model of biopsychosocial. So he would say that not only psychiatry, but all medicine is biopsychosocial, because when you are treating, when you're diagnosing and treating a patient, no matter what condition you're treating in that patient, you have to understand that the person has biological factors, so has genetics, and their genetics are influencing their health. There are other biological factors because they can traumas or medications they take, drugs they take. Those are biological factors that are affecting their health. But also there are psychological factors that are affecting their health. So their self-esteem, their attitudes, their beliefs, their perceptions, their temperament, their personality, coping skills, psychological trauma, grief, social life. So there are factors in health that are influenced by psychology, as we will see. And also there are social factors and cultural factors and environmental factors that are also influencing health. And nowadays you will hear a lot of discussions about the social determinants of health, social determinants of mental health, and how a person can have a very good genetics and maybe have a very strong psychology, but if they are born in, and you can see that in Calcutta, and I can see that in New York, if they are born in poor neighborhoods and they don't have access to good healthcare, and so So their social environment is making them more prone to have to have poor health and poor mental health. So this is very important, because all health, all health, and here it says mental health, but actually all health, all medicine is an intersection of these three aspects of biology, psychology, and social environment. So with that, what is psychology? So psychology, it has the symbol is this Greek letter, that this Greek letter is psi. So the psi is this Greek letter, and is the symbol of psychology. So psychology, from the Greek term, it literally means psyche, means the soul, or the mind, and logos is the science. So the same that biology is the science of bios, that is life. Psychology is the science of psyche, that is the soul. So psychology is a broad area of knowledge. It's a whole science, has different aspects. It has theoretical aspects, and it has applied aspects. So, and it has a lot of branches. So people who would study psychology at university, they would study the human mind, and how the psyche affects different aspects of individual and social life. So you have a lot of aspects of basic psychology. So cognitive psychology, that is understanding how people make decisions. Developmental psychology is seeing how people, since they are born to when they are dead, how their psyche changes. Neuropsychology, personality, social psychology. So how people when they are in a society and when they are with other people, they change the way they behave. And also there are a lot of applied areas of psychology, and one is the clinical psychology that we are going to present. But there are other areas. So psychologists, people who study psychology, they are not only clinical psychologists. They some of them, they work in education, helping children. Some would work in human resources for many companies, and there are psychologists for elite sportsmen, men and women. So there are many applications, and one is clinical psychology. So I'm saying here, medical psychology and clinical psychology, they are not exactly the same, in the sense that clinical psychologists, they are usually people who are trained in psychology, and then they do a clinical training in psychology. So they are clinical psychologists. But medical psychology is a little bit broader, and it involves all the psychology that is applied to medicine, and can be understood not only by clinical psychologists, but also by doctors, by nurses, by other healthcare professionals. So, and as we said in the biopsychosocial model, so the psychological aspect, the psychological sphere is very important in health. And we not only see this in mental health disorders, we see it in all medical conditions. So for instance, we know that the main risk factors for the major diseases in the world, so major diseases in the world, are cardiovascular diseases, cancer, and depression and other mental disorders, and drug abuse. So, but for instance, what is behind cancer? So behind many cancer, especially behind the lung cancer, there is tobacco, and tobacco is a behavior, and it's an addiction. Behind many cancer, there is alcoholism, and that's a behavior and can be understood with psychology. Also, because many yeah, please stop writing on the screen. I think it's, yeah, maybe funny, but it's very distractful. Thanks. So, but also, the physical health influences the psychological health. For instance, a person who is diagnosed with cancer, they would they will experience psychological reactions to the cancer. So medical psychology involves, on the one hand, understanding the behavioral risk factors for medical disorders, but also understanding the psychiatric disorders that are medical disorders, but also understanding how physical disorders affect the mental health. And yeah, as I say, one example is psycho-oncology. So it's an area of medical psychology that is meant to help people with cancer. So people who are diagnosed with a terminal disease, they experience a process, a psychological process that goes from not understanding anything, from not wanting to accept, then to rage, and then to eventually to acceptance and to peace and dying in peace. So psychiatry and clinical psychology. So psychiatry and clinical psychology, they are two different, although they are, in a way, they are siblings, sibling professions, but they are different. In which way are different? Because clinical psychology, as I said, is accessed through studies of psychology and then studies of clinical psychology. It depends on the country. For instance, in Spain and in many countries, I don't know in India, but clinical psychology is the pathway is similar, but instead of doing medical school, people go to psychology, and then they would have to do a residency, a training in clinical psychology. Whereas the psychiatrists, they are doctors, they have studied medicine, and they do a specialty training in psychiatry, sorry. And it's different because, and the word psychiatry also has the psy of the mind or the soul, but also has iatry, and iatry means treatment or care, the same as in Greek they will call pediatry or pediatrics is the care for children, or geriatrics is the care for elderly. So psychiatry or psychiatrics is the care for the soul in medical care. So in this way, they are different. So the psychiatrist is a doctor, it's a medical doctor that is specialized in diagnosing, preventing, diagnosing, treating, and rehabilitating mental disorders. And we can talk another day, or I don't know if other of the lecturers will talk specifically about mental health. About what is a mental disorder. That would take us for another lecture. But in summary, a mental disorder, as seen by psychiatry, is a medical disorder that can be conceptualized through the biopsychosocial model. So it's a problem that has some biological factors, that has some genetic, some psychological factors, and some social factors. For instance, schizophrenia. So schizophrenia, we don't yet understand fully how schizophrenia is originated and works, but schizophrenia has a very strong genetic component. And schizophrenia, actually, the main treatment are medications that change the neurotransmission in the brain, especially the neurotransmission of dopamine. So we know that in schizophrenia, the biological factors are very strong, but also we know that the psychological factors are very, very strong as well, because the main symptoms of schizophrenia are behavioral and cognitive and emotional. But also we know that the social and the environment play a role, and we know that, for instance, cannabis use increases the risk of developing a first episode of schizophrenia, and probably the risk it does a synergy with genetic factors. So a person who is maybe by psychology, by personality, they are more introvert, and also they have a genetic loading that increases for them the risk of schizophrenia, and they also are in an environment of poverty and trauma, and they use cannabis, so the risk for developing schizophrenia will be higher. So you'll see how in mental disorders, they are medical disorders that follow the biopsychosocial model. And there, a psychiatrist is the doctor that prevents, diagnoses, and treats them, and can use different treatments, can use psychological treatment, can use medical pharmacological treatment, sometimes can use other biological treatments, and neuroscience-based treatments. And the clinical psychologist is also is able to diagnose psychological disorders, including mental disorders, always providing that those mental disorders are not caused by a physical disorder, because sometimes there are physical disorders that cause mental disorders. And they are able to provide psychotherapy, and they are specialists in doing psychotherapy. But psychotherapy can be done by a clinical psychologist, but also by a psychiatrist that is trained in psychotherapy. But keep this distinction very clear in your mind, because this is something that keeps coming, and many people would call me psychologist. And for me, it's not an insult, because I think that psychologists are great people. I work with them a lot, and there are things that many psychologists can do that I cannot do, but it's different. Okay, then we'll cover two main historical conceptualizations of medical psychology and mental health. And the first comes from psychodynamics. So psychodynamics, the origin is in Sigmund Freud, was an Austrian. Well, he was a neuropsychiatrist, and he was trained in neuropsychiatry in France. And at that time, neurology and psychiatry in Europe were part of the same specialty. And he came to understand and develop this model, this psychodynamic model of understanding that mental disorders and sometimes physical disorders, they have a dynamic origin, in the sense that they are caused by a struggle, by interior and unconscious struggle in the mind of people. So he had two models that he integrated, and I will put a link so you can read more about these models. So he's the father of the unconscious. So he has this topographic model that is usually represented as an iceberg. So he will say that there are three levels of psychology in the person. First is the conscious level. So today we are very conscious that we are attending this lecture, that we are seated in this chair, and that after this lecture we have to do this or that, and that's the conscious thing. Then the subconscious, the subconscious are things that are in the back of our mind, and we can recall them when we need it, but they are not currently in our mind. But maybe they can come, because if we start thinking, what are we going to do after this lecture finishes, and then we'll remember that we have to go and buy the groceries for the next day or whatever. So that is subconscious. So it's in the back of our mind, but we can recover. We can recall it. And then he would say that the same as icebergs, most of the iceberg you cannot see it because it's below water. Most of the mental activity of the human being is unconscious. So it's in a level that is very deep, and that we are not even conscious, nor we can recall. We by ourselves, we don't know that it exists, but is actually has a lot of activity and is influencing ourselves and influencing the way we behave. And this can only be accessed through hypnosis or through the dreams, interpretation of dreams, because in the dreams we are not conscious, in the sense that we are feeling, but we are not controlling what we are doing. And then he would have this other model, the structural model, and he would say that also in the human psyche, and there are three levels. So first, the id. He used these Latin names. Id means like the thing, or it. Ego, that means I, and superego, that means super I. So he would say that the human psychology is the struggle between these three parts of our mind. So one is the id. So the id is ruled by instincts, and the id wants pleasure, and wants maximum pleasure and minimum pain. And the id once by itself is like a horse without bridles. So they wants sex, they wants sleep, they wants power. But especially in the Freudian model, he would think that the main instinct that moves the id in human beings is sex. So then you have the ego, and the ego is the reality. So and we as human beings, we know that we are living in a society, and that we are not only instincts, we have also desires to be good people, and but also and finally is the superego, the morality. So he would say that superego and the id are eternal enemies, because the id wants sex, wants pleasure, wants to do whatever it wants, but the superego wants all the contrary. The superego is very spiritual, and the superego is very normative, and the superego wants to oppress and wants to suppress the id and the instincts. And he would say that society would create for us a superego, because imagine, and we need that, because if we were only if we would do everything following the id, so that will be very, very problematic. People would end up in the prison as pedophiles or as abusers. So the ego is in the middle, and the ego tries to in the unconscious, the ego tries to negotiate between both of two. And so and Freud and on the psychoanalysis, he would say that mental disorders, they would emerge through a conflict of the id and the superego, and that conflict, he would say, that conflict would be related to the sexual development of individuals. So he would have these phases or stages of psychosocial development. He would say that the developmental psychology is guided by sex. So he will say that, and that all human activity in a way is related to sex. So he would say that the babies, when they are sucking the breast of their mothers, or they are doing oral sex, because they are pleasing their oral instincts. And when they learn to control their anal sphincter, so that's symbolizing the anal sex. And when they start to playing with their penises or with their vaginas, so they are in the phallic stage. So and then when they are schoolboys, they are not very much caring about sex. They are caring about playing, norms, studying. But when they became adolescents, and then through the rest of their life, they would engage in genital sex, in the sexual intercourse. So Freud would say that, and this was very problematic in the time. It was a time that society was very, very conservative in Europe. So there was a provocation, and he would say that mental disorders would emerge first from a conflict of the different parts of the mind, but also from a problem in the proper development of the sex We would also have two. I have to think about this very quickly. He will also have, so because psychoanalysis then evolved after Freud. There were a lot of divisions, even among his disciples. There were some disciples that would think that Freud was he tried to control everything and tried to impose his ideology and his agenda, and that his theory did not have any empirical support. There were some of the followers are saying that Freud was emphasizing too much the sex, and that there are other instincts like the instinct for power that are important as well, or maybe more important than sex. But but from Freud, we have inherited the psychoanalysis that is still as a form of psychotherapy that is still practiced by many, although it's a minority, although in some countries like in Argentina, psychoanalysis is kind of the mainstream form of psychiatry. But in other parts of the world, it's very minoritarian. But there's also some advances or some therapies on some models, the psychodynamic models that are originally based on Freud, but they have incorporated also neuroscience and other new research and new theories. And two things that from Freud are very, very important for almost any kind of psychotherapy nowadays. One is the defense mechanisms. So they would say that people will resist to change behaviors, to change thoughts, because they are using defense mechanisms that are unconscious. So, for instance, one unconscious defense mechanism is projection. So, for instance, when somebody is blaming us for doing something, we project, and we tend to say that we are not that we are not to blame. There's another person to blame. So or sometimes we are projection. We are attributing our feelings to other people. So we are interpreting other people's feelings based on what we are feeling. And the other very interesting concept is transference and countertransference. And this is very important in medicine, not only in psychotherapy. So this means that when we are meeting a patient, so the patient is having a reaction, a psychological reaction, unconscious reaction to us based on their previous experiences. For instance, we may be remembering this patient about their father or whatever. And also, and what we are doing, so the patient is feeling things about us, and maybe the patient maybe sometimes falls in love with us or hates us. So that's transference, and countertransference is what the patient is eliciting in your unconscious mind, and you may also fall in love with the patient or hate the patient, or the patient may be remembering you bad experiences. So that is very important, and we have to be aware of transference and countertransference to harness it in our interactions with patients. And the second historical model is the cognitive behavioral model that is also, it includes emotions. So this was it also allowed to Aaron Beck that this year in June, if he makes it, hopefully, so he will be 100 years old this June, and he lives here in the United States and has a school of therapy, the cognitive behavioral therapy, that has a lot of ramifications. So the cognitive behavioral therapy is a model of medical psychology and psychotherapy that is based on an empirical research on the 50s on new models. So instead of emphasizing the unconscious and the instincts, they try to emphasize the human psyche as having three main elements. One is the behavioral, the thoughts, and the feelings. And this is a triangle that influence each other. So, for instance, when a person, and also it has another triangle that is the cognitive triangle. So the core beliefs, we have beliefs about ourselves, beliefs about future, and beliefs about others. So for instance, a person who is depressed, he has negative beliefs about himself, so he has low self-esteem. He has negative thoughts about the future, so he's pessimistic, and he or she has negative thoughts about others, so they may think that others don't understand them. And also a person with depression, so we have these negative thoughts, these depressive thoughts, and these thoughts are making the person feel sad. The emotion is sadness. And also this emotion of sadness is making the person to not wanting to do anything, to not want to behave, to not engage in behavior, and to inhibit themselves. But this triangle, it retrofeedbacks. So at the same time, imagine a person that, for instance, with the COVID pandemic is confined and his behavior is limited and cannot meet people and has to stay, or has COVID and has to stay at home and bedridden for 10 days. So that behavior is making the person think that that is unworthy and to have negative thoughts, but also this behavior is making the person have negative feelings. And the same can be applied to anxiety and to other psychological issues. So we are almost finishing. So introduction to psychopathology. So how we understand the psyche of people, not only as mental health professionals, but also as doctors. How do we, from the biopsychosocial model, how do we understand the psychological part? So there are different ways. Yeah, as I said, Freud would propose the interpretation of dreamings, interpretation of artwork and hypnosis, and free association of thoughts. But usually what we do is, so we look at different aspects of the psyche. So first we look at the appearance, because the way a person is showing up may say something about their psyche. So for instance, now I'm very well dressed because this is a very important lecture, and I'm so happy to be here and so honored, and I'm so privileged to teach to you. But if I was wearing my pajamas, so you will think that there's something wrong with me. Or if I was if I was crying, you will think that maybe I'm sad. So when we meet a patient, we look at the appearance, and sometimes appearances are deceiving, but many times they are giving us clues. We are looking at their interactions, their behaviors, how is their body language, how is their rapport, the contact with the patient. If the patient is restless or if it's very inhibited. We're looking at the speech. If the speech is monotonous or the speech is very fast or there's no speech, the patient is muted. We look at the mood. So we ask the patient how is they feeling, and we look at the affect as well. If they are expressing affect, if they are expressing appropriate affect. So we are also asking about their thoughts, the quality of their thoughts, the content of their thoughts. And in another lecture, we can go into more detail on these mental health, mental status examination, and do some role playing or show some videos. But the way people think, and on the inside, and so we also see if the person is aware of how they are feeling and thinking or not. Okay, and there are kind of systematic ways to observe and to record mental health symptoms in mental examination. And this leads us almost to the end. Actually, this is 9. This says 8, but it's 9. So introduction to psychotherapy. So taking into account the psychological part of people, we can use it even if we are not trained in formal psychotherapy. All doctors, all healthcare professionals are able to do some sort of psychotherapy. So to harness therapy, to harness the psychological factors to to help the patient. And there are many. Yeah, please stop writing on the screen. There are different ways of approaching the mind. So there's a psychodynamic way, behavioral, cognitive, central emotions, and there are also different, very specific. There are more general approaches to psychotherapy. Everybody can do psychotherapy. So when you meet a patient and you are being kind to that patient, you are being empathetic to that patient, you're already doing psychotherapy with that patient because that patient is feeling understood, and that improves their mood. And there are different specific ways, professional ways of doing psychotherapy, some individual and some in group. So finally, before we end, let's go back to the discussions. So based on what we said and these different models of understanding the mind. So in the case of Miss Francisca, that she had this cough. If you want people to write in the chat what of the two models, psychodynamic or cognitive behavioral therapy, what model do you think is more interesting to explore with her under treatment? If you want to put in the chat, and I will tell you in a second what we did with this patient. Psychodynamic or cognitive behavioral? Okay, somebody say psychodynamic. Anyone else? Somebody say CBT. There's no right or wrong necessary, but yeah. So our approach was psychodynamic, although we also use elements of CBT. But so when I met this lady, after she had been for 30 years with CAV and had gone through 10 different surgeries and nothing was helping her. So what I did, I just talked to her, and I was eliciting to tell me all her story, all her life, and she told me things that she had never told anyone. And there were no sexual abuse, and there were nothing terrible, but there was something that she was that it was in the back of their mind and in their unconscious that she had never processed and she had never accepted. And it was when she moved from her hometown after having married. She moved to a rural area in the north of Spain where they speak a different language, a very different language, the Basque country, and the culture is very, very different. And she felt also that she was not accepted in the town, and that her kid had a lot of bullying and a lot of problems at school, and she suffered a lot, although she never talked about that, and she never put words into to her feelings. But just talking to me and telling me her story. When she was talking to me, and I met her a lot of times in the hospital, she never coughed. She never coughed, and think that this was a lady that for 30 years was coughing almost every 5 seconds. But she never coughed while talking to me in the story. And after talking to me, she never coughed again. And I did not do any miracle. I just talked to her and elicited her story, and we processed that trauma that was unconscious for her. So you will see, especially in medicine, a lot of medical disorders that where you don't find any physical cause. There is a psychological cause and there's a psychodynamic cause. And sometimes just doing a psychodynamic approach, you will see not only people with chronic cough be healed, you'll see blind people that will start seeing again, and you will see paralytic people that will walk again, and many other seem to be miracles. They are, in a way, they are not miracles because there are physical symptoms that were produced by their mind unconsciously. And in the second one, what approach do you think we should take? and we're almost finishing. Yeah, conversion disorder. Yeah, conversion. And I have seen people, well, I'm not sure if I've seen blind people, but I saw a couple of girls that were paralytic, and nobody was finding the cause. And we did psychotherapy, and they start walking. It's like the Gospels of Jesus saying people walk. Yeah, CBT would be in the second case. So this is a typical case of depression that has a biopsychosocial component. So depression also has some biological components, and apparently there are some problems with the neurotransmission, especially of serotonin. But then there are psychological factors. The triad, we say, the triad of negative thoughts. So this person is feeling negative about himself because he lost his job. So he's saying, okay, so I'm unworthy. He's negative about the future. He's thinking, I will never get a job again. And he's negative about others. So he's saying other people, they don't like me. And also has this negative triad. So so as he's feeling sad, he has these negative thoughts, but he withdraws, and he's at home, and he will not do sports nor meeting people. So behavior, emotions, and thoughts are negative. So how do we break it? One, we can, for depression medications, there are medications that help, but also with cognitive behavioral therapy, we can help this person. We can attack the three parts of the triangle. We can target their emotions. We can target the thoughts, and we can help this person understand by himself that the thoughts he's having are not realistic, because he's a very strong person and he was working very well. And the thing is that he had bad luck, and there's a pandemic. And there's a pandemic, so he lost his job, but that's not because he's a bad person. And so we can target the thoughts, and we can target the behavior. So we say, okay, please do sports and go every day for a run if you can. Put your mask or whatever, but go for a run. And if you cannot go out, do sports at your home. And the person will say, but I don't feel like doing sports. I don't have energy. But you say, no, but do it, because when you do sports, even if you don't think you have energy, you will realize that you have energy, and that will improve your emotions and will improve your thoughts. And yeah, here are some papers covering most of the topics I talk about. And when you have the materials, you can search these papers on the internet. Some may have a paywall, but hope you can access through the university or other channels. If there's any specific problem, you can tell the course organizers, and I could potentially get some of these papers for you, but try first. Okay, and thank you very much. And I hope I'm able to visit Calcutta, and I hope you're able to visit New York.
And we session in 5 to 10 minutes. There's the two things that one is the sessions every month, and perhaps we can explore ways in which psychiatric society can work with society. And the Indian government has shown a lot of interest in this. So we can have a visual program which foreign faculty like Victor and others can medical. This is an informal session. Perhaps next one can.
I think, yeah, we were not hearing very clear. Yeah, so you will have access to the slides, and I hope you.
Good evening.
Hi.
It was an excellent presentation.
Thank
You
very much.
almost covered everything about psychiatry. It is really, really amazing that you covered very big chapter. And what I'm telling regarding psychiatrists and psychologists, in fact, in India, the scenario is very cool, I think. In fact, I am also practicing along with psychologists and psychiatrists and psychologists. We have a very good relation because it is a teamwork.
Yes.
It is a teamwork. For the treatment, for the sake of the patient, we have to, both of us, we have to contribute, not only both of us. In fact, mental health professionals includes social workers also, and the other personalities, those who are working in this field. So thank you so much again for excellent presentation.
Yeah. Thank you very much. In the United States, yeah, we have also a very good relationship, but sometimes it's impoverishing because some psychiatrists, they see themselves as just pharmacologists. So there's just people who put medications, and people in society will feel that the psychiatrist is just like a person that puts medication. But it's very important that those of you, and I encourage all of you, well, who
What I believe, I'm Dr. Gautam Shah, President of Indian Psychiatric Society. What I believe, psychotherapy, to some extent, we have to not only psychiatrists, in any branches of medicines, all the doctors should know. Because it is so important. Thank you again.
Yes, and differ between clinical psychologists and rehabilitation psychologists. I'm not sure in India how you differ. In the United States is different because a rehabilitation psychologist, he would not do clinical psychology, he would do other kind of psychology. Okay, if there are any questions, you can type it. I still have a couple of minutes, and now people are, you can leave the session if somebody also want to stay. IED, what is IED, Barnita? What does it mean? Rehabilitation psychologists work with psychiatrists. Well, in rehabilitation, the main work is of the doctor, the physical therapists, and the psychiatrist will be consulted if there's if the rehabilitation doctor thinks that there's a psychiatric illness, there's a mental disorder, but usually many cases they are not involved by default. Breaking Bad News is related to psychology and how? Yes, totally. Intermittent explosive disorder. Okay, yeah. Let me cover first. So intermittent explosive disorder, yeah, it's a mental disorder. And what's the treatment? Specifically, it's a very, I think in my experience, very rare disorder. I haven't seen people with that disorder. I have seen people with anger, but not specifically with that disorder. And probably CBT helps, and especially behavioral treatment would help a lot. Breaking Bad News, yeah, Breaking Bad. So yeah, all doctors and healthcare professionals at some point in their lives, they with this challenge of giving bad news, be it of cancer or whatever, and sometimes, and we also have to be equipped to do that, no matter what is our training. So you have to learn that with experience and also with some theoretical knowledge in medical school. Sometimes there will be some doctors that when they have to give bad news, they don't feel courage and they will call the psychiatrist to give the bad news, but that's bad practice. The psychiatrists, we are happy to give bad news, but every doctor should be responsible to give the bad news to their patient and should know how to. And it takes a lot of empathy, it takes a lot of listening, and it takes understanding that people, when they receive bad news, they have this process, and they don't understand, they don't accept, and then they will feel angry, but eventually they will accept. And what could be the identification threshold for a psychologist for referring her client to a psychiatrist? So usually when you feel that that the levels of anxiety, well, for instance, when there is a psychotic disorder, the patient will need medication and will need a diagnosis. When there are physical symptoms, it's good that a psychiatrist, that is a doctor, sees the patient as well. And when you feel that anxiety and depression are very severe, it's good for them to have a medical assessment by a psychiatrist, and eventually sometimes taking medication. Does the chemical imbalance theory still hold true? Yeah, it's not yet very well understood. There are even some contradictions in the model, but the fact is that SSRIs and antipsychotics and the main drugs we have in psychopharmacology, they work. And maybe we don't know exactly how they work in some cases, but they work. And I have to finish in a couple of minutes, sorry. So I'm gonna answer a few questions. What factors do you consider? What line of treatment to administer via psychodynamic or CBT or other? How do you understand? Simply the symptoms. Well, it's in part is the training you have. So if you are very well trained on a specific way of psychotherapy, you should deliver that that modality. But also there's evidence, so you have to check the evidence-based medicine. And for instance, you will see that for anxiety disorders, the psychotherapies that have evidence are especially CBT. For borderline personality disorder is dialectic behavioral therapy and other therapies. And you have to search for each, as you do in other areas of medicine, for each disorder, what are the therapies that have evidence. And sometimes there are more than one. And if you find that there's more than one, then you have to deliver whatever you are trained to do, or if not, refer to a professional. Can a medical social professional can work with psychiatry? Yeah, they work with psychiatry a lot. For instance, in the United States, they are training psychotherapy and master social work. They do psychotherapy, and we need social workers in our work as psychiatrists. Okay. Well, yeah. I think there's no more questions, and sorry, I have also to end. And yeah, thank you very much, and we'll meet again. And again, I wish your best, and I pray for all of you in these difficult times that India, especially India, but all the world is facing with the pandemic. Thanks.
Thank you.
Well,